Hi, it's Dr. Minkoff, LifeWorks Wellness Center. I want to talk to you about infections and brain fog. So if you haven't watched the earlier video on brain fog, watch it because it'll give you a basic understanding of brain fog and what it is. Sometimes brain fog is caused by an infectious process in the body. The infection itself sets off your own immune system to attack your nervous system or your brain cells. And the most common one that we see is Lyme disease. So Lyme disease is actually a group of infections that a person can get from an insect bite, usually a tick, but it could be a mosquito or a flea or a bed bug. That insect bit something that was infected, they got infected, they bit you, you got infected. The infection gets into your body, it can affect your nervous system, and one of the reactions that can occur is an autoimmune reaction within your nervous system, and that can cause you brain fog. So there's about a half a dozen organisms that we look for that are part of the Lyme complex. They can cause brain fog. Other infections, underlying infections, could be things like what's called mycoplasma. It's another stealth infection. It's a low-grade infection. You don't have a high fever, and you don't have, you wouldn't see anything on your physical exam, but it's lingering there. It's below the surface. There are many herpes infections which do this. Herpes 1, herpes 2, herpes 6, varicella, which is chickenpox, Epstein-Barr. These are common infections that we see in people. They can be below the surface. You may not have a fever or a sore throat, but you feel fatigue and brain fog. They can trip this autoimmune reaction, and they can cause you to have this. So infections are important in this. One of the most common infections that we see are dental infections causing brain fog. The person has a tooth abscess, they don't have pain, and they don't know it. And the dentist looks at their teeth, they look okay, they do an x-ray, they don't see anything. But if you do a CAT scan, a very detailed CAT scan of the teeth, you may see an infection. Sometimes it's an infected root canal, sometimes it's an infected deep pocket within the gum, sometimes it's an infection where a tooth was actually pulled and there's a pocket there and there's an infection there. And these bacteria that live in these various places produce biotoxins. And those biotoxins set up an autoimmune reaction. So your immune system starts to attack your brain cells. So that's infection and brain fog. It's very common. Another one that we see all the time is people who have had exposures to mold toxins. Okay? They had a leaky faucet or leaky roof or a window, and there was wetness, and now that wetness grew mold, and that mold puts out biotoxins, and the person breathes them in, and that mold toxin produces an autoimmune reaction and a direct toxic infection within the brain itself. And unless you eliminate the mold toxin, clean up the environment, the brain fog won't clear. And if you do, the brain fog will clear. Okay? So these are all aspects of this thing which are important. So infection and brain fog go together, and whenever someone I write on my list as one of their symptoms, brain fog, I'm looking, okay, where's the infection? Is it in their sinus? Is it in their teeth? Is it in their gut? They're not having a big symptom, so it's hidden, and we have to find where the hidden infection is. Okay? So that's infection and brain fog. Hope this helps. See you next time.